All right. Assalamualaikum warahmatullahi wabarakatuh. Selamat pagi. Good morning, everyone. Welcome to the Malaysian Healthcare Conference 2021. I am Zai Mozani, Director of External Relations for KSI Strategic Institute for Asia Pacific. Up here, you can see the logo with the organizers. Fortunately or unfortunately, I will be your master of ceremony for this morning. The COVID-19 pandemic has been on the minds of everyone in almost all countries, and it has brought into light many questions, especially the link between public health and health of economies. Both are very much closely intertwined, and one cannot exist without the other. The pandemic itself is changing the way nature and modus operandi of practically all aspects of healthcare systems. And Malaysia is no exception to this disruption. This is why you're here, to gain insights, to gain ideas, to ask tough questions. This is why KSI is organizing the Malaysian Healthcare Conference 2021. The theme of this conference is accelerating the transformation of health systems in a pandemic, challenges and opportunities. The conference will have one ministerial keynote and two special keynote addresses. We have brought a total of 25 speakers to talk in 4 sessions over 2 days. So to kick off this morning, we have the honor and privilege of welcoming Tan Sri Malkayo, President of KSI Strategic Institute for Asia Pacific, aka my boss, to give the keynote, to give the welcoming remarks. So Tan Sri Malkayo, the floor is yours, sir.
Yang Berhormat Dato Sri Dr. Adham bin Baba, Menteri Kesihatan Malaysia, Tan Sri Dato, tuan-tuan dan puan-puan yang saya hormati sekalian. Selamat datang, selamat pagi, salam sejahtera. It's a great honor for us to warmly welcome the Honorable Minister of Health, Yang Berhormat Dato Sri Adham bin Baba, and all of our speakers and sponsors for attending today's Malaysian Healthcare Conference. I believe today we have more than 200 people who are registered for this conference, and we hope that this conference will be very useful in sharing ideas and disseminating information. I am very grateful to the Minister for taking time off your very busy schedule to join us here this morning to deliver our opening keynote address. I wish at the outset to thank the Honorable Minister and all the officials and staff of the Ministry of Health, as well as the volunteers, for all of your fine efforts, your dedication, diligence, and commitment during these difficult and trying times. The sacrifices of the Ministry of Health officials and frontliners are deeply appreciated by all Malaysians. Setinggi-tinggi terima kasih banyak. Today's Malaysian Healthcare Conference will discuss a number of key issues faced by the healthcare sector. One, how do we prepare for future pandemics, and what lessons can we learn from this pandemic? I must congratulate the Ministry and JKGAV for the remarkable success with the National Immunization Program. They have done almost 500,000 doses on a daily basis. We must all unite to support the Ministry of Health and health frontliners in fighting this invisible war against COVID-19. We need a whole of nation and whole of society effort to win this war against our invisible enemy. Much has been said and written about SOPs. May I today suggest to Yang Berhormat Menteri whether we can come up with a new nomenclature or a new phrase to describe SOPs that will give a greater focus on the need for compliance. So perhaps the SOPs can be renamed as COVID Control Regulations, or CCR, that will place a lot of priority on the need for the public to comply with these regulations. We also fully support the National Recovery Plan, which we hope to discuss further during the National Recovery Summit next Tuesday. It is not easy to balance health and economy and lives and livelihood. We all need to save lives, but we also need to save jobs and businesses. We therefore hope that the MOH, MKN, and the NRC can come up with a balanced approach going forward that is based on science and data to guide decision-making. The conference today and tomorrow will also discuss digital health and telemedicine, as well as mental health, which is a serious challenge facing many, not only in Malaysia, but also globally. So once again, I welcome Yang Muhammad Dato Sri and all of our distinguished speakers for joining us here at today's Malaysia Health Conference. We want to also acknowledge our sponsors, IMU and Pfizer, and all of the speakers, moderators, the media, and all participants. We hope you will all have a meaningful and informative conference. Sekian, terima kasih.
Thank you, Tan Sri Michael Yeo, for the opening remarks. I just want to quickly recap Tan Sri's speech. Tan Sri Michael thanked the frontliners and also Ministry of Health and also the Minister of Health for coming and making time today, and also for the sacrifices and the contribution of the healthcare professionals and frontliners. Tan Sri mentioned an interesting idea, which is to change SOP, Standard Operating Procedure, into CCR, COVID Control Regulations, as a nomenclature, so that we use CCR as opposed to SOP to better streamline and enforce regulations on COVID-19 as opposed to using the word SOP. Tan Sri Michael Yeo expressed gratitude and his thanks for the sponsors, specifically IMU and Pfizer, and also all the partners for participating today. So thank you, Tan Sri Michael Yeo, for those remarks. Now we have the honor and privilege of having YB, Dato Sri Dr. Adham bin Baba, Minister of Health Malaysia, to deliver the opening keynote address. The minister's speech will be touching on the theme of this event, accelerating the transformation of healthcare systems in a pandemic, challenges and opportunities. YB Dato Sri Dr. Adham Baba, the floor is yours. Dipersilakan.
Bismillahirrahmanirrahim. Yang berbahagia Tan Sri Michael Yeo, President KSI Strategic Institute for Asia Pacific. Excellencies, distinguished guests, speakers, member of the media, ladies and gentlemen. Assalamualaikum warahmatullahi and salam sejahtera. It gives me a great pleasure to address all of you at the Malaysian Healthcare Conference 2021, organized by KSI Strategic Institute for Asia Pacific. Congratulations for your efforts in bringing together inspiring leaders from around the healthcare sector to discuss the issue of healthcare transformation in this conference. Today, themes on accelerating the transformation of healthcare system in a pandemic, challenges and opportunities, is apt and relevant with current healthcare climate, both locally and globally. It has been over a year since COVID-19 was declared a pandemic. The pandemic has and is placing enormous strains on all of us. It has undoubtedly brought about huge changes in healthcare system all over the world. One of the major impacts is in accelerating the digital transformation of healthcare globally. Malaysia was able to put together a COVID-19 digital response with 6 main focus areas. 1, strategic risk and communication. 2, community engagement. 3, operational efficiency. 4, insight and foresight. 5, infrastructure and upgrade. And number 6, research and clinical trials. COVID-19 has also made the case for the importance of healthcare transformation and emphasized the importance of health equity and access in our communities. Health and wealth are interlinked. Health system across sector to support more economically active societies. We need to start shifting paradigms in healthcare by making systemic challenges more obvious, by proving the case for integrated and digital delivery and more flexible workforces. In our fight against the pandemic. One area which is equally important to us is on mental health. Not just our frontliners, but the population in general. Human psychology also has an impact on the outbreak. Thus, proper strategies to manage human psychology, especially mental health, is very important to break the vicious cycle. We need to manage mental health using cognitive behavior approach, mindfulness, and spiritually. By practicing the cognitive behavior, mindfulness, and spiritually strategies, we may enhance our acceptance, optimism, and commitment to prepare for a new and renewed normal. Managing our mental health is our utmost priority now to ensure the curve can be flattened and COVID-19 can be defeated. Ladies and gentlemen, one of the defining aspects of the current pandemic was the unprecedented level of misinformation, conspiracy theories, and rumors reproduced by lay and social media related to COVID-19. These can only be counterproductive in the fight against the current pandemic, both in the short and long term. Perhaps this is an outcome of the pandemic taking place during the social media age. Social media platforms have responded to the majority of social media posts related false by fact checker by removing them or attaching various warnings. Facebook has recently announced its policy on COVID-19 related misinformation. Facebook will remove posts with false claims about all vaccines. Consistency in the public health messaging, as well as increased funding dedicated to fact-checking, seem to be needed as the immediate first step. It seems inevitable that post-COVID-19, there will be a review of policies, guidelines, and regulations, as you say, relating to individual rights. There also needs to review the implementation of drastic public health measures, as well as the governance of new technologically driven solutions within healthcare. The fight against COVID-19 is already pushing health system toward a more integrated and value-based approach to managing diseases. In this respect, the massive disruption that societies are facing as a result of the pandemic, it also represents an important long-term opportunity to create more patient-centered health system. It should facilitate continuous learning through sharing standardized data and benchmarks, and as a result, employ resources more effectively to meet patient needs. Out of crisis come learning and innovation, both to face our immediate challenges and to build more sustainable health system for a healthier and safer world in the decades to come. In conclusion, I wish all of you a fruitful conference and my appreciation to KSI for inviting me here. With Bismillahirrahmanirrahim, I officially declare open this Malaysian Healthcare Conference 2021. Thank you. Stay safe. Terima kasih.